game time.
Okay.
Okay.
How much time?
We
Less
don't
than a
have.
minute. Less than a minute.
Just hit my results.
We got in! 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 To Ottawa, sorry. We got in Ottawa.
You remember what that was like? The fear, the anxiety, the excitement. So many years of hard work summed up in a 30-second clip. It was a good moment.
These are the faces of medical school graduates from the University of Ottawa. But to me, they'll always be my classmates. In March 2017, I documented the day they discovered where they'd be training as a resident. A moment that would forever change their lives. From psychiatry to surgery, from Nova Scotia to BC, everyone set out on their path as a physician. Of course, back then, none of them knew that yet another life-changing moment was on the horizon. These are the faces of our new doctors. This is their story.
This is what I've waited for. This is it. This is my dream.
And what's your goal for the future?
Being the best doctor I can be and still being the best mother and wife I can be and human.
It's hard to believe that it's been 3 years. Whew, sorry. It's okay.
I'm so grateful for where I am now. I've accomplished my dream of becoming who I wanted to be. And I think all the sacrifices that were done finally paid off. And I wouldn't change a thing.
I ended up in medicine through a series of fortunate events that I never planned or could predict. It just one step led to the next step, led to the whole path. And it's nice to know that what I landed on after careful consideration actually does really fit for me.
While I was in my undergraduate studies, I was able to work in the mental health department at a public health agency. I saw how much people needed this help, and so that really spurred my interest in the field of psychiatry.
There aren't a lot of physicians in my community. There aren't a lot of Black doctors out there. It's not like a representation thing that I see very often. It took a leap to even realize that I could be a doctor, that that was a possibility.
In 5 years, maybe I'll be right back here talking to you about what that's like as a physician with a husband and maybe some kids running around. And
A lot has changed for me. I'm now a doctor, so that's a big one. I passed, they let me through, and they haven't kicked me out yet. Gurdeep and I got married, so I'm now a wife. And last year, we welcomed a little baby into the world. And so now I'm a mom too. It's been quite the ride. It's been a busy 3 years.
The realization of this happening, I'm not matching for this year, not being a resident, not being a doctor, not graduating at all.
3 years ago, I was not a happy camper. 3 years ago, I was probably the lowest point of my life. But I'm happy now. I matched to the program that I wanted. It's a bit surreal how things have changed.
2017 has been pretty bad so far in the past, 4 or 5 months. Yeah.
2017 seemed bad, but 2020 seems pretty bad too.
Leading up to March 2020, I think I had seen one email from work prior to this, just kind of news about this sickness that was happening in China. But then I go into this meeting and all the leaders of the department are really talking about the quick changes that are going to happen and need to happen. And then right at the end of the meeting, someone, I think they received a Twitter notification and it said, first case of COVID-19 in Hamilton. I can remember being told, you're gonna see your colleagues die. I don't think I was ever told in medical school that my life would be on the line. It felt out of a horror or disaster film.
Almost 3 years to the day of their residency match, COVID-19 takes its place on the timeline. We've all watched the news and heard from the experts. But what exactly does a global pandemic look like through the eyes of doctors so new to practice?
When you signed up to be a doctor, you signed up to do this. You're like, I guess I did. But did I know that we were gonna have a pandemic and that this is what my life would look like?
I was in a bit of a different situation this year in that I was out in London, England, doing a master's in sexual health research. I booked a flight and packed my entire apartment with a few hours' notice. When I got on that plane, I came back to Winnipeg and everything was different.
We saw what was happening in Italy, we saw what was happening in New York, and I didn't know if that was coming for us here in Canada. You're getting probably 20 emails a day about new changes and new protocols and new rules and new ways to do things, and it was scary and it was anxiety-provoking.
It was a moment of terror, really. Being afraid of so many things, because if things got really bad here, the expectation is that residents could potentially go to the ICU, and I need to be ready for that. I need to be ready to be that person that the system needs me to be.
I came back to Winnipeg with that in mind, that if they needed me to come in, I could. I just felt really bad for not being there, to be honest. Definitely a bit of guilt there. Yeah, pandemics bring up a lot of feelings, huh?
Every day I wake up and there's always a little bit of imposter syndrome. Like, am I qualified to do this? And I think the pandemic really made it, evident.
Do I really belong here? Am I faking it till I make it?
My imposter syndrome was improving until COVID hit, and then it just came back full force.
I think everybody has their own crisis. Again, I don't know if panic is the right word. It's something even stronger than that.
So that fear of figuring out what I need to know, and then the underlying fear that always exists with, I think, every doctor, the fear of not being good enough when you need to be good.
It was frightening because in medical school, we get trained to do our medical assessments very differently. It meant a lot having eye-to-eye contact, and even your tone of voice is different when you're virtual, when you're talking to someone on the phone. It's those nonverbal cues, I think, that make a huge difference. I've had patients with chest pain that upon asking questions, you're really worried that they're going through a heart attack. There you were left with trying to manage them virtually, and then you tell them to go to the emergency department and they're like, no, I'm not. I don't want to get exposed to COVID.
Initially, we saw a lot of people presenting with health-specific anxiety that they were going to contract COVID-19 or a family member was going to contract COVID-19. And then as the pandemic progressed, it really was the isolation, being disconnected from relationships, services, hobbies that people use to stay well.
The influx of mental health patients I saw in this period of time was astounding. People who were previously stable, and all of a sudden, full-blown anxiety, full-blown schizophrenia, full-blown bipolar.
Symptoms of depression, suicidal thoughts. So not only are we dealing with the panic of the unknown, we're also sitting there thinking there's going to be lots of mental health difficulties after this. And when the medical side of the pandemic ends, the mental health effects are going to continue.
It was a Saturday evening, 7:30, 8 p.m. at night. My pager goes off. I'm not on call, but my pager goes off. And I'd had what we called at that time, an unprotected exposure. I remember being in my bedroom and just panicking and packing up all my clothes and taking everything into the basement and taking my toothbrush and going down there. And I remember sitting on that bed down there just sobbing, being like, I've exposed my husband now. I've exposed my kid now. How do you put the people that you love so much at risk? Gurdeep's been with me long enough. He knows that eventually the panic passes. And he comes downstairs and he said, remember when we said, we're in this together? Here we are. We're doing this together.
Physicians and healthcare workers are like everybody else and are not immune. We're gonna have to help our colleagues out from a mental health perspective.
I've definitely thought about my classmates and what they're going through, especially the ones who have been doing things like Emerge or family medicine. And I talked to them quite frequently during the beginning, and they were stressed, and I was stressed for them and stressed for all of us.
I often think about my psychiatry colleagues in ICU or internal medicine who care for COVID patients. I worry about how they're dealing with this whole situation and how they're adapting. And I hope they're keeping safe and doing well.
We're people who have gone through the same process that can be stressful and difficult, so we really do understand each other and we can empathize with each other really well. I really feel that video is really applicable to now and the pandemic. We experience the same things, we mature together, and we mold each other into adults, into physicians, into leaders, into compassionate and caring people.
You know, when I prepped for med school interviews and prepped for residency, they ask you this all the time. Why doctor? Why doctor? And now that I'm past all that stuff, and now they've let me in, and they can't get rid of me at this point, I can honestly say, I feel like it's just what I was meant to do.
I don't know if this sounds corny or I think I felt the call. I've been placed in situations where help was needed and I had the skills to help.
The little things that I can do to help patients and help people. Anyone can help anyone. And I hope this pandemic teaches people that you can help anyone, no matter what.
You'll have patients that will remind you of that. A patient who's just so grateful and so thankful that you were there for them when they needed you. And it just snaps you back.
I think that's what keeps me going, is seeing that I'm making a difference in other people's lives.
I just find there's something really beautiful about the human experience. I don't know why and how we ended up here, but like, I'm glad we're here doing our thing the way we are. I just want to help be a part of that.
March 2021, I think will look a lot like right now, unfortunately. I don't foresee huge changes before then. The cases are ramping up again, and I think it's going to be that way for a while. I think we're going to have ups and downs and ups and downs.
Hopefully, we've learned from the past year to slow the spread and slow the disease and be safe.
We're all in this together. You can't be chacun pour soi, you know, like to each their own. That doesn't work in a pandemic. We need to look after each other. And I think as a healthcare system, we need to look after everyone.
Here we are, we're still practicing, we're still caring for patients. Not exactly the way we had imagined we would, but we're trying our best to help them the best we can.
I hope that we can continue to be outwardly caring and supportive. I hope to continue to be part of the solution.
Times are different. Needs are different. And despite what obstacles lie ahead, we'll be there with you to overcome those obstacles. To make sure that you get the care and the help that you need so that you can not just survive, but thrive in your life.
The last time we spoke, the very end of the conversation, I asked you where you thought you'd be in 5 years. We're talking 2 years earlier than expected, for reasons that none of us expected. Where are you in the next 5 years?
Hopefully not sitting here and still talking about this. Hopefully we can move on to a different topic.
I hope so too.
I think back to the crowded rooms with smiling faces, to the goals and dreams of my old friends. And when I think about what we're all up against now, I have faith in them, and I have hope. We can look to the joys of the past, we can acknowledge the uncertainty of the future, and we can hope.
We'll be with each other.